And welcome. This is Radio Doctor on your Women Radio 91.7. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on your Women Radio 91.7. Radio Doctor is broadcast from 10 a.m. Mondays through to Fridays. My name is Miracle Phillip, and I am so pleased to be here with you for another edition of Radio Doctor on your Women Radio 91.7. Our Radio Doctor for today is Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. Good morning, Dr. Abiola. How are you today?
Good morning, Ms. Phillip. I am doing very well.
It's always a pleasure to get to be here with you, and we're glad that we get to do this for yet another Friday.
Yes, thank goodness it's Friday.
Oh, yeah. On Radio Doctor today, Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, will be consulting and advising on nutrition and infertility. Now, the phone lines will be open for you to be part of the discussion this morning, for you to get to ask as many questions as you have for Dr. Abiola. The phone lines are 07000 917 917. We also have our toll-free number for women, 0800 1235 917. And then our SMS and WhatsApp line, that is 0703 175 6537. You can also get to follow us across our social media platforms on Facebook, on Instagram, on X, on YouTube at WFM 917, and get to listen to us live from wherever you are across the world via our website www.wfm917.com. You get to ask Dr. Abiola questions on nutrition and infertility. All right, let's get into it. As a medical practitioner, Dr. Abiola, what is the relationship between nutrition and infertility?
Well, there's a profound relationship between nutrition and infertility because your reproductive health relies on the availability of specific nutrients. And if you have inadequate nutrition, it can affect your hormone levels, it can disrupt, and that's for men and women. It can disrupt ovulation for women, and it can also impair sperm quality or reduce sperm quality. In Nigeria, a lot of some of our common nutritional deficiencies are iron deficiency, folic acid deficiency, and both of those are essential for reproductive health. You know, I like statistics, so it's important to see it's important to know how significant this problem is. And about 25%, up to 25% of Nigerian couples experience infertility. And when you look at it, culturally, we always think it's the woman that has an issue. I think I mentioned that before. When I do infertility consultations, 80% of the time it's the woman that shows up on her own. But I have to remind her and the family, the statistics show that 40% of the infertility cases are male factor. Another 40% are female factor, so about even. And then it leaves about 20%, which may be combined or unexplained factors. So infertility is significant, affects 25% of Nigerian couples, and both people need to be checked. For iron deficiency, it's really a public health issue. About 50% of women of reproductive age suffer from some form of iron deficiency, and that shows up in a term called anemia. And anemia due to iron deficiency, we see it often during pregnancy, but we can also see it in women that are menstruating. Almost half of them will have some degree of iron deficiency, and very few of them are even aware. The folic acid deficiency or folate deficiency is less common now because everybody knows, or there's some awareness and programs to increase folate intake, and they've even started putting it in flour and some other thing called fortified wheat and grains. But it's still a concern, especially in rural areas where you may not have excellent supplementation, or those foods may not be available.
All right, thank you very much, Dr. Abiola. You've said quite a lot, really, this morning. I know that we've had discussions over the past few weeks about fertility, infertility, and I love that we are bringing the nutrition part to how this impacts. But one would want to know exactly how nutrition really impacts on fertility, both in men and also in women.
Yeah, and it impacts nutrition impacts fertility. First of all, let me preface. I like to bring significance to the topic.
Okay.
Before, in the last 3 to 4 years, let's say last 3 years, there's been great advances in understanding disease. And one of the fields of medicine that I'm now heavily involved in is called functional medicine. And functional medicine is where you combine Western tactics, lab tests and drugs, but you also pay attention to the entire person. So you're looking at them spiritually, emotionally, and of course, diet is part of it. So, when I was going through medical school, we did not have very many lectures on nutrition, just one. And what we were trained to do is prescribe the right medication for a disease. But now, and I've seen the benefits where I've expanded and included the emotional part, the physical part, the spiritual part, as well as the nutritional part. And I've seen exponential gains in my patient outcomes. Patients have just exploded, doing better. Arthritis can cure arthritis, cured somebody with PCOS, which is polycystic ovarian syndrome. If she's listening, she has twins right now, struggled to have a child for 3 to 4 years after getting married. And by changing, the diet change was about 90% of it. We did add some supplements on top of that, but dietary change, and she got pregnant within 3 to 4 months. So we don't focus enough on nutrition. A lot of us medical practitioners don't know enough about it, and we all need to take time to learn about it. So, we talked about nutrition impacting hormone regulations, egg and sperm quality, and reproductive cell protection. In women, poor diet can lead to irregular ovulation. And in men, what we typically see with a poor diet is low sperm count or poor sperm motility.
All right, thank you very much, Dr. Abiola. Okay, I think I have a call right here. Hello, good morning.
Good morning.
Good morning to you. Okay, we missed that call right there. I've been getting this persistent call, but then don't worry. If you are listening, you can get to call in and ask Dr. Abiola any question that you have on what we're discussing today, which is nutrition and infertility. Dr. Abiola Ajayi is the MD and CEO of ROA Specialist Hospital. He is consulting and advising on nutrition and infertility. Hello, good morning.
Yeah, hello, good morning.
Good morning. What's your name and where are you calling from?
My name is Mr. Kunle from Ogun State.
You're welcome, Mr. Kunle.
Please, I just want to ask Doctor a fast question.
Okay.
Now, my wife and I, we have 2 children. Now, the first is 9 years old. The second is 6 years old. But we just started to try since February to try conceive. Although last year, or was it in 2021, they had a miscarriage. And she did an evacuation. So, since February this year, we've been trying to conceive. Try to get her conceived, but it's not been possible. So, what I've noticed is that a period normally comes within like 25 days period. Like if she has a period on the 1st of the month, the next will be on maybe 24th or 25th of the month. So just like 25, 26 days period. But what I noticed this past month, she did the last one on the 25th of August. And funny enough, the day before yesterday, that was on the 11th, she saw a period again. Just 17 days interval, which has never happened before. We've been together for so many years. So I don't know what would have caused it, because it was not up to 25, 26 days cycle. You understand?
Yes.
It was not up to 25, 26 days. So it was just 17 days. And normally she does appear for 3 days. And it came for 3 days because it stopped last night. But she felt so much of pain and some clotted blood came out. Yeah, that is it. So I don't know what would have caused it. That's why we are still trying, but I don't know. We are trying to get to a gynecologist soon to check. But what they told us was we've been trying that maybe it's It's just 6 months now that we've been trying. So they said we should report both of us there. I don't know what is happening about the period. That's why I just had to complain.
Right.
17 days instead of 25, 20 days. So whatever would have caused it, that's what I want to know.
All right. Thank you very much.
What's the age?
Okay,
what's the age of the man and the woman?
Okay, the call is gone already right now.
Oh, okay.
So I don't know. Dr. Abiola, I think you want to say something, but I also want to add that he could get to consult with you, like you always say, for free.
Yeah, I would love. This sounds like right up my alley. I would love to. So listen to the end and collect my details. But for those listening along, you mentioned they have a child, 2 children, 9 and 6.
Yes.
And they even had a miscarriage in 2021. So we're talking about secondary infertility. Technically, by the book definition, it's a year of unprotected sex 3 to 5 times a week without seeing a pregnancy. But in Nigeria, we have so many cultural pressures around having children. I never had the opportunity to wait 1 year. I usually, by 6 months or more, we start having discussions. And the number one cause would be advanced age, where you're having some of these issues, usually because the egg quality decreases and sperm quality also decreases. But when you're not talking about the secondary question, which is why is her cycle length changing? Cycle length and is even getting shorter. Cycle, that's the days in between her menstrual cycles. There are many different causes. Some of them perimenopause. If a woman is getting close to her 40s, in her 40s or 50s, is possible. The number one thing I think about is hormonal imbalance. These are changes in women, estrogen and progesterone. Those are extremely important. And what can cause those hormonal imbalances? At times, thyroid. You have high thyroid or low thyroid. Stress, which we don't pay attention to enough. Chronic stress, increased stress at home or at work can affect your cycles. And the one I mentioned before, polycystic ovarian syndrome, can also cause it, and that can come and go. So maybe she didn't have it before, but it's possible she has it now. And this is one of the things we're talking about. PCOS can be managed with dietary changes and lifestyle changes. Fibroids, if you had a small fibroid when you had your first child and it kept on growing, fibroids can interfere with it. And then 2 other ones, infections and excessive exercise or excessive weight loss, and the opposite. For exercise, excessive weight gain. All these factors are the things that we will discuss privately, but can lead to changes in your menstrual cycle.
All right.
I could talk about that one for an hour on its own, but I like to hit the highlights.
I do hope that we also get to have a conversation on menstrual cycle as well to right here on Radio Doctor. Okay, so Kunle, I hope you've gotten yourself clear on this. Even though at the end of the show we're going to put out Dr. Abiola's number just so you can reach him and get yourself consulting with him. There could be some further details that he'd like to get from you. It can't be all spot on right here on your radio. But if you've just tuned in, this is 19 minutes past 10 on your Women Radio 91.7. It is Radio Doctor. We have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. And you can get to calling. The phone lines are 07000 917 917. We also have a toll-free number for women. It's 0800 1235 917. And an SMS and WhatsApp line for you to ask any question, 0703 175 6537. I seem to have another call. Hello, good morning. Hello, good morning. Okay, I missed that call right there. So we'll get back to, talking nutrition and infertility now. Dr. Abiola, are there specific vitamins or minerals that play a crucial role in fertility? But before you go on, let me take this call. Hello, good morning.
Sure. Hello. Good morning, my sister.
Good morning. What's your name?
Good morning.
Good morning.
My name is Ajayi.
Good morning.
Your name is?
Good morning. My name is Ajayi. That's Ikechukwu.
Okay, Ikechukwu. Where are you calling from?
I'm from Magodo.
Okay, you're welcome.
Yeah. Like the person that called Lisa, I think I have the same issue, almost the same issue. This is almost this 5 years because my son is last month August making 5 years. Till now, we are not getting any issue. He had miscarriage on October 2 years ago, 3 months baby. So they evacuate everything inside, but since then, I've not been able to conceive. So when we went to hospital, they say maybe infection or all those things. So they gave her drugs. Me, I noticed that my sperm is not like as before. So it not become a suspect of a thing. But there's a time between entered that along the way, till now, let's see in miscarriage again. But last week, we went to hospital. One hospital, the doctor said he will call us, both of us. When we went, now discovered that he will do a scan test for me and check her womb. We tear the womb a little and check her womb, check her vagina, other things, check if there's any issue. So I don't know. Since then, I'm not able to conceive. So that's what I'm trying to. If there's any issue, can be solved.
All right. Ikechuku, please stay on the line just in case doctor has any question for you.
Yeah, let's get his age of his wife and his own age.
How old are you and how old is your wife?
Yeah, I'm 45 years. My wife is 33.
45 and 33.
Very good.
Yes.
And they said they have one child already?
Yes.
Is that true?
Yes.
Okay. And how old is that child?
It's like 5 years. Also, almost last month makes him 5 years.
Okay. I'll take it from there.
Okay.
So can I go ahead and answer?
Yes, please, you can.
Yeah, so he's, we're talking about secondary infertility again. Already has a child, finding it difficult to get pregnant another time. He's 45 and she's 33. She's still in her prime reproductive range. He's a little bit advanced in terms of above the age of 40. And at times, as you get older, especially after 40 and in a larger degree after 50, your sperm quality can decrease. Your amount of sperm can decrease, and motility or movement of the sperm can decrease. It's also important to know that all sperm are not created equal. So if we look at sperm under the microscope, some of them may have one head, some may have two heads, some may have half a tail. Some of them may be genetically damaged. And if one of those genetically damaged sperm is the one that fertilizes the egg, you can now end up having an embryo or a fetus that's developing with a severe anomaly or a severe problem, let me say. And your body at times, the female body at times, will notice that and now push that out because it would never have become a viable child. And that's what we call miscarriages. At times, he mentioned that he saw clotted blood come one time. It's possible that was also one of those things where you had a fertilized egg, poor DNA quality, and you now end up with a miscarriage or an early menses. So we keep all that in mind. I'm happy where he went. They did a thorough physical exam, checked vagina, checked all those things. But now we need to go a little bit deeper. We need to look at his sperm quality. And if it's not, some of the things that we're talking about today, change in nutrition can help improve sperm quality. You just have to know that sperm, even though a man is always making sperm from when he's born to when he dies, it takes about 3 months to turn over. So any dietary change, even if you're using supplements, you have to be consistent for at least 3 months before you're going to see any kinds of changes. So for the general answer, that's the best. And of course, if he has more, we can call.
All right. Thank you very much, Dr. Abiola. I do hope you've gotten the answer to your question, Ikechukwu. Even though you might want to talk with the doctor even more. So we have some of our doctors who are available for further consultation on the TeleDoc app as well. But then in the course of the program, we're going to put out Dr. Abiola's number for you to get to reach him further for consultation. Okay, so Dr. Abiola, we were talking specific vitamins or minerals that play a crucial role in fertility.
Yeah, we'll highlight 4 of them.
Okay.
We talk about folic acid, commonly also known as vitamin B9. It's important for egg quality and as well as early fetal development. So, when I have people trying to get pregnant, for example, the last caller, I would already have her on some of these supplements already. A lot of people think, oh, wait until I'm pregnant, I have a positive pregnancy test, then I start. But I like to start early because some of these things are good not only for egg quality, but also for early fetal development. In Nigeria, where can you find folic acid in your diet? Things like ugu, okra, and they have some fortified grains that have it too, but deep those green leafy vegetables, you'll find folic acid. Ugu, spinach, bitter leaf, and those. When you now talk about zinc is the next one, and I would talk to the last caller about zinc because zinc helps boost sperm production and reproductive health. So that's also a very important one. It also supports your immune function and helps regulate hormones. In Nigeria, we can find zinc in egusi, peanuts. You can find it in your meat products like beef, goat, chicken, and turkey, and even in your fish like sardines and mackerel and catfish. And then our beans, brown-eyed beans and black-eyed peas. The third one that's important, vitamin D. And even though you get most of your vitamin D is produced in the body with sunlight, about 20 to 30 minutes of direct sunlight a day. We have plenty of sunlight to help produce vitamin D, but you also need is to activate it. So when we take it into our body, it's in the inactive form. The sunlight helps activate vitamin D. But it's very important for sperm health as well as ovarian function. So you can also get some vitamin D from the fish like mackerel, sardines, and catfish, egg yolks, and even dairy products. Right, but I don't always start with dairy products because not everybody can tolerate them. And I don't like mushrooms, but mushrooms also have vitamin D. So when you, like for example, the man that just called and he's probably maybe having poor sperm quality, vitamin D is one of the supplements I'm going to put him on. Zinc is another one of the supplements I'm going to put him on along. I have a list about 15 different supplements I use to increase or improve sperm quality, and these are two of the hallmarks. The last one we'll talk about now, iron. We talked about iron deficiency anemia in women. We said almost 50% of reproductive age women in Nigeria have some form of iron deficiency, and it's very important for ensuring oxygen transportation, but it's also very essential during pregnancy because, the baby needs oxygen, the woman needs oxygen, and most of the time during pregnancy, iron levels go down. So in your diet, you can look at meats, your beef, goat meat, chicken, your organ meats like liver, which I can't stand, but you can find lots of iron in those kind of things. Your fish like mackerel, tilapia, and catfish are good for those. And your deep green vegetables, ugu, bitter leaf, all of those have high amounts of iron as well as folic acid.
Thank you very much, Dr. Abiola, for sharing this with us. I'm just taking note of all of them and checking the ones I've been eating regularly.
How did you do?
And I think I ticked all. Okay. So if you've just tuned in, this is 10:30 on your Women Radio 91.7, Nigeria's first and only radio station for women and their families. It is Radio Doctor, and we have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. He is consulting and advising on nutrition and infertility, and I tell you, he is open to taking all of your questions today. So we have this text message here. Says, good morning, WFM. I have questions to ask concerning fertility. 1, what could be the reason for failed implantation as a woman? 2, after mating with your partner and you keep feeling implantation pains that could last for weeks, but in the end, the embryo could not implant. Okay, Dr. Abiola, this is for you.
Yeah, so I'm honestly, I'm struggling to understand how she can know that implantation is occurring. So for women, we have menstruation, which is bleeding, shedding of the lining, but ovulation, which is the mature egg coming from the ovary down into the uterus. Implantation is where failed implantation is where a fertilized egg does not successfully attach to the lining of the uterus. At this time, the egg is microscopic, right? So I don't know how you can feel it, but I will talk about why you can have failed implantation. The number one cause, or the number one thing I see in practice, is a hormonal imbalance, especially hormones like progesterone. And we would do something like a hormone profile, but taking blood on specific days and seeing, does she have the progesterone levels enough to support a developing pregnancy. So that often can make implantation fail, and is another cause of early trimester miscarriages. The second one, poor egg or poor sperm quality. If you have eggs or sperm with DNA abnormalities or low quality, it can result in embryos that are less likely to implant successfully. The next one I'll say would be anatomical, so uterine abnormalities, whether you've had fibroids or uterine polyps, or you've done an evacuation before and you may have some scar tissue, it's called Asherman syndrome. That can also prevent the embryo from implanting. With that goes along the thin uterine lining. If the lining is too thin, the embryo will not have enough. When we say implantation, it's like planting a flower in the ground or a plant in the ground. You have to have good topsoil. It needs to be thick and moist, and that topsoil is like the endometrium or the lining of the uterus. And progesterone is like the water that waters and wets the lining. So the lining too thin, poor progesterone, you got poor eggs or poor sperm, or if something's wrong with the uterus, fibroids, scar tissue, etc. Those are the top causes. We go further, I won't go too much into detail, but autoimmune disorders where your body is actually attacking the cell, we do see that often, and of course pelvic infections. Then the main focus of today, we're talking about nutrition, and I'll add lifestyle. So poor nutrition, and either one can affect your sperm quality, can affect your egg quality, excessive alcohol, excessive smoking, excessive stress. All these can negatively impact fertility and reduce your chances of implantation. So I hope that helps begin answering the question.
All right. Thank you very much, Dr. Abiola. And just like you said, I hope that that's been able to answer the question. Dr. Abiola, I have a question for you, too, in line with what we're discussing. Can deficiencies in certain nutrients affect fertility? If so, which ones? I know you listed some of these vitamins, folic acid, minerals, zinc, vitamin D, iron. What if someone is having like 2/4 of some of these vitamins and minerals? Can it still affect their fertility?
Oh, definitely. Even one of them, having one of them way out of line can affect your fertility. So you got it right. You mentioned folic acid, vitamin D, iron, and zinc. And like I said, I pay attention to about 15 different vitamins and minerals. I just don't want to bore our listeners, but the top 4 are what we just mentioned. And the reason why is that it can affect your egg quality, it can affect your sperm quality. And I'm happy with the questions that the listeners have been asking, because it really revolves around this. You having poor implantation, or you're having miscarriages, or you're having difficulty getting pregnant or infertility, it could be traced to any one of these vitamins or multiple of these nutritional deficiencies. So they are extremely important. Even one of them out, too low of an iron. For example, too low of iron can cause anovulation, or meaning the egg does not release. So the patient will be menstruating, but the egg will never come down. So you will never get pregnant. And the fact that she's menstruating is also reducing your iron. Every time you bleed, it reduces iron. So it's a compound effect. And usually we can improve this with diet and supplements. Like zinc, like the first person that I called, zinc deficiency can affect your sperm production and your hormones. And if we have poor sperm, then we have poor fertilization, which can lead to poor implantation, which can lead to infertility. So there's no way to get around how important these nutrients are in fertility and fertility management.
All right. Thank you very much, Dr. Abiola. I'll take a call here. Hello. Good morning.
It's Paul that calling.
Okay.
Hello.
Paul. Good morning. Welcome.
Yes. Sorry, I want to ask about if somebody is getting eye problem, or somebody is getting eye problem, what is the person can do for the eye? Which fruit you will eat so that the eye we can get clear more better? so that the eye can be seen more better. That is what
all
is
right.
happening.
Okay, thank you so much for calling, Paul. Doctor, he's asking for foods that could help him better with eyesight.
Yeah, so, and you're free, Miracle. I have a very good eye doctor that works with us, so we may bring her on the show and talk more about it. But I'll start off with vitamin A. It's probably one of the most important vitamins, especially for night vision. And you can find vitamin A in carrots, palm oil, sweet potatoes, and, of course, our favorites, ugu, spinach, and bitter leaf. Vitamin C is extremely important. It helps prevent cataracts, and it slows the progression of AMD. AMD is age-related macular degeneration. It's just something that the macula is a part of your eye, and it can degenerate over time. But with vitamin C, it can help reduce that or slow the progression. Of course, we should know where we get vitamin C. Mango fruits, so oranges, mango, pineapple, guava. There's a drink, hibiscus drink. Zobo has vitamin C in it. And the last three, vitamin E, omega-3 fatty acids, and our friend zinc can all improve eye quality. We haven't talked about vitamin E, so I'll say you can get those primarily in nuts, like ground nuts, almonds, egusi, palm oil has vitamin E, and omega-3 fatty acids, which are essential for not only the health of your retina, and it can prevent dry eyes, and it can reduce that AMD I talked about. But you find, omega-3 fatty acids, especially in your fatty fishes like mackerel, sardines, and catfish.
All right, Paul.
I could go on and on. I love nutrition. I love nutrition. I could go on and on, but those are the main ones.
All right, thank you very much, Dr. Abiola. I hope, Paul, that you've gotten yourself clear on that, so you take note of all that Dr. Abiola has listed. Well, if you've joined in, this is Women Radio 91.7, Nigeria's first and only radio station for women and their families. It is currently 22 minutes to 11, and we have with us Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital. He is consulting and advising on nutrition and infertility. And don't forget, you can be part of the conversation by asking any questions that you have. 07000 917 917, a toll-free number for women, 0800 1235 917, and our SMS and WhatsApp line, 0703 175 6537. Hello, good morning.
Hello?
Yes,
Sorry, I'm calling back. My name is Ike.
Okay, Ike.
Yeah, I'm jotting down some vitamins.
Okay.
You mentioned about to help the sperm to generate or what, I don't know. But there's a vitamin we mentioned, vitamin D, right?
Mm-hmm. Yes.
Yes.
Vitamin D and V9, something V9.
That's folic acid. Vitamin B9, that's folic acid.
Okay, that's V9.
Yeah, B9 is the same thing as folic acid. Just call it folic acid. Most people don't know it's B9.
Okay. So
add zinc to your list, and vitamin C.
Vitamin C.
And zinc.
Zinc, peanuts, okra.
Mm-hmm. Very good.
What are beans?
You want two more? Coenzyme Q10.
Okay.
Which you can find in your fish and your meats. And selenium, which is excellent for sperm motility. You can find that also in fish and meats.
Okay. Thank you.
You're very welcome.
All right, thank you very much, IK, for calling back. I'm sure you got what you needed, the answer. Well, Dr. Abiola, I want to bring this one in. He made mention of beans, and there's been this back and forth on whether beans is protein or carbohydrate. And still in my question here, how does protein intake, play a big part in fertility? I'd like you to address that.
Yeah, the first one, the first question is protein, beans, sorry. Beans are a significant source of protein, but they also contain a significant amount of carbohydrates. So the answer is both. The
Okay.
beans they're a good plant-based protein source, so it's useful, but they contain complex carbohydrates. So the type, and they also have the high fiber. So the type of carbohydrate they have, a complex carbohydrate, is fine. It's not like a sugar. Not say fine, but it's not as detrimental as taking in a simple sugar or any of these things like fructose and whatnot.
Okay.
The carbohydrate that you find in bean is primarily in fiber, and the fiber is excellent for our body. It helps support digestion as well as mood and other things. So it's very, very important. The your second part of your question, I think, was talking about. Remind me.
Yeah, protein intake, how that plays a big part in fertility.
Yeah, it's important. It's essential for supporting our reproductive health in general. It helps with the production of hormones because you have to understand hormones, what we call steroid hormones, like your testosterone, your estrogen, your progesterone. They're made from cholesterol and protein, right? So, and you also require proteins. Also required for the development of eggs and sperm. Sperm has protein. Our DNA is protein. Our eggs have protein. There's almost no part of our body that doesn't have protein. So to ignore it would be detrimental. I don't really counsel people that go on straight vegan diets where they're eating only animal or only plant-based proteins. I would love for somebody to be able to mix in the two, animal proteins and plant-based proteins. It's important to get from both. Your body absorbs the animal proteins better than the plant-based proteins, but they're all good because plants have essential nutrients like the folic acid and the iron that we mentioned. But animal proteins like the mackerels, the catfish, the tilapia, chicken, goat meat, they have high-quality proteins which are essential for fertility.
All right, thank you very much, Dr.
Can I add one little caveat?
Okay.
It's not all protein that's good. We have processed meats, which you want to avoid at all costs. Those are like hot dogs, sausages, excessively fried and battered meats, even excessive things like anything that's processed, you want to limit that because it can lower your fertility in both men and women.
Very interesting. I do hope that we're taking note of all of this. Processed meat. Take note. Okay, Dr. Abiola Ajayi right here with us. He is the MD and CEO of ROA Specialist Hospital, and he is consulting and advising on nutrition and infertility. Right now it is 16 minutes to 11, and we'll take your calls as well as your questions in the course of the program. Dr. Abiola, I'd like us to look at the impact of being underweight or overweight in influencing fertility. I see that sometimes women are worried. Am I underweight? Am I overweight? How does this affect my chances of getting pregnant?
Yeah, weight plays another large role in fertility, and both people that are underweight and overweight have risks, and the main risk is hormonal imbalances. So women that are underweight may have irregular cycles. They may even stop ovulating because they have very low estrogen levels, and even those that even exercise, some of these Olympic athletes or professional athletes, they may be fine for their sport, but at times that can even cause them to stop ovulating altogether. For overweight, excessive body fat can also cause a hormonal imbalance. There's something called the peripheral conversion of estrogen, which is just a long way of saying your excess fat can form estrogen. And if you have too much estrogen, it can disrupt ovulation. If you have too little estrogen, it can also disrupt ovulation. So it really needs to be in balance. For men, being overweight directly affects sperm quality. So if you're overweight, weight loss through portion control, and I do so many different dietary plans for my patients can oftentimes fix those hormonal imbalances, which can disrupt sperm production and ovulation. So healthy weight is a key for both men and women for fertility.
And doctor, are there any dietary patterns that can enhance fertility?
Yeah, and I like how you said dietary patterns. I don't like using the term diet because for most of us, diet means something temporary, right? Because we're doing this for a couple of months because I need to lose weight to fit in this dress, or I'm doing this because I want to show off some muscles. I prefer to talk about lifestyle changes. I like dietary patterns, things that you're going to incorporate into your daily life, and you keep doing it, right? So I try to focus on things that you can do, that people can do consistently. You know, you have some diets where you just drink cucumber juice every day for forever. Nobody can do that forever, right? But some of the things that you can do is increase your amount of leafy vegetables. I look at the average Nigerian plate. It's rare that we have a daily dose of leafy vegetables. You know, here spinach, lettuce, which is for salads, ugu. They're not only rich in folic acid and iron, but they're essential for our fiber. And really, you should have some form of leafy vegetable at least once a day. I try to get it in every meal. Some other ones are beans, which we mentioned before, are high in protein, and they also have iron, which helps ovulation and sperm quality. And then we have been taught to run away from fat, but there are healthy fats. And we've been taught to run away from our native oils like palm oil and coconut oil, but they are great because they have high levels of omega-3s. So, and omega-3 fatty acids, like we mentioned before, also help support fertility. So things like palm oil, avocados, groundnut or peanuts, they all have healthy fats, and those healthy fats are fantastic for supporting fertility. Then the last one, which I don't mention, but I just want people that are following along maybe on Google or on reading textbooks, they're going to mention whole grains. These are things like corn, millet. Millet is where we make pap from, and yam. They do help. They do have some use in fertility or just in general health, but I try to limit that as much as possible. Excessive carbohydrates are not good for fertility and for weight control.
All right, thank you very much, Dr. Abiola. I know that people get to turn to supplement. So does this also help turning to dietary supplements to improve fertility? And if so, which ones are recommended?
Yeah, you know, when you talk about dietary supplements, the important thing is to really talk about that person's diet. For example, are they vegetarian or are they avoiding certain things? Like where I have people that are avoiding animal proteins, they may be deficient in iron, folic acid, and other ones. So then we will supplement those. For the other ones we mentioned, zinc, you know, we talked about where zinc can be found in different meals, but if you're not eating those things, we can supplement that. All of these things can be supplemented. Vitamin D, zinc, protein, even selenium. I'm just mentioning all the things that we talked about. But the key to know is that your body prefers to get it from food. So if I'm trying to, let's say, increase my folic acid concentration in my blood, I can be taking folic acid tablets every day, which helps. But if I were able to incorporate the food that is high in folic acid, it would help even more. And at times, when we do both, we get the benefit of both.
All right. Thank you very much, Dr. Abiola. If you've just tuned in, this is Women Radio 91.7. Particularly, it is Radio Doctor. And we have with us Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital. And right now, it is 10 minutes to 11. He has so far so good been consulting and advising on nutrition and infertility, and we've received your calls and also your messages as well. Well, we'll also bring this question to Dr. Abiola now. Can food allergies or intolerances impact fertility? I remember you were listing out some of these food, and sometimes there was one you omitted, the dairy, and you said something about people who oftentimes maybe they are lactose intolerant. Can this also impact fertility for these people?
Oh, definitely. And the pathway is important to note. When you have a food allergy or food intolerance, it can cause something called inflammation. And inflammation, if I have a swelling in my foot, I can call that inflammation. The inflammation just brings in blood and different immune cells and stuff to the area. But when those cells come, they can disrupt your nutrient absorption as well as interfere with hormone regulation. And this whole topic today, we've been talking about nutrients. Of course, they need to be absorbed. So nutrients are absorbed through your digestive tract. So if you now put something in the digestive tract that you're allergic to or intolerant to, you're going to have inflammation in the digestive tract. And so the nutrients, the other nutrients like the zincs and the iron and the vitamin D, they won't be able to be absorbed easily or as well, and it can lead to a deficiency. That deficiency is now going to lead to infertility. So some of the large ones that we see, let's mention like the dairy. Dairy has something called lactose, and you can be lactose intolerant. A lot of us out there, especially with our black skin, are lactose intolerant. You eat ice cream, drink milk, your stomach wants to run, or you have stomach cramps. The fact that you have the stomach cramps or your stomach running is telling us that there's inflammation there. And now things are not going to be well absorbed. So the second one that we see a lot is gluten sensitivity. That's found in many of the grains, and it's harder to pick, and which is why I try to not avoid, but I try to limit grain intake a lot. And some of these things some people even have intolerance to cassava in Nigeria. So in Nigeria we see milk, cassava, gluten, and all of these things, these digestive issues can increase inflammation and potentially impact fertility because of malabsorption or poor absorption of nutrients.
Wow, very interesting.
What I usually do, sorry to cut you off, I identify them. There's alternates, so there's things like coconuts and plantain and soy that we can substitute in there, which may not trigger some of these responses.
All right. Thank you very much, Dr. Abiola. There are certain areas that we've looked into in the course of this discussion. I've outlined them. I'm going to discuss with my producer so we look at them in-depthly, because this also is a conversation, food allergy. All right. So far we've had Dr. Abiola Ajayi, who is the MD and CEO of ROA Specialist Hospital, for today's free consultation and advice on nutrition and infertility. And I really want to say thank you so much for joining us, Dr. Abiola. It's always a pleasure having you with us on Fridays.
It's my absolute pleasure. Thank you.
All right. So Dr. Abiola is the MD and CEO of ROA Specialist Hospital. For consultation, you might want to grab a pen and a paper to get this one. You can reach Dr. Abiola Ajayi, MD and CEO of ROA Specialist Hospital, on 0913 579 5108. 0913 579 5108. Also, for appointment and directions, you can reach this line 0816 601 4901. 0816 601 4901. Dr. Abiola, people want to reach out on your social media handles. You'd like to share that with them?
Yes, we have a website at www.thepheroahospital.com, or visit us at ROA Specialist Hospital on all the social medias that matter, Facebook, Instagram, and Twitter for now.
All right.
Thank you.
That is ROA Specialist Hospital. You'd find that on social media. Well, thank you to you for listening and also for your calls and messages. Just to let you know as well that you can also find our other doctors who are, guests on Radio Doctor in the course of the week. Dr. Akinola, who is a pediatrician, Dr. Abiola Ajayi, the fertility physician, Dr. Alozie Ndubuka, who is the medical director at St. Ives Family Hospital, as well as Dr. Pascal Obodo, a general practitioner. You'd find them very much available for further consultation on the Teledoc app. Just download the app and you get to find them, and you can get to have conversations with them for further consultation. Well, it's been a pleasure this week with you, my wonderful friend. Radio Doctor on Women Radio 91.7 is Nigeria's first specialized radio health program, broadcast from Mondays through to Fridays, 10 a.m. Do join us next week